of a new report. This important new report, entitled Europe Abortion Laws 22-25, Policies, Progress and Challenges, is examining the legal landscape on abortion across Europe. This large event will bring together legal and human rights perspectives to discuss the findings and their implications, with a particular focus on regional trends and the Swiss context. Today, you will hear Leah Hoctor. Leah Hoctor is the Vice President for Europe at the Center for Reproductive Rights. Welcome, Leah. And Noemi Grütter. Noemi is the campaign coordinator for gender justice and individuals at risk at Amnesty International Switzerland. Welcome, Noemi. Now, I'm very, very glad to give the floor first to Leah.
Thank you very much, Geraldine, and thank you very much to the Press Club for hosting us this morning. I'm delighted to be here on behalf of the Centre for Reproductive Rights. Just to briefly introduce the Centre, for those of you who don't know us well, we are an international human rights organisation working to advance sexual and reproductive rights across the world. We work in 5 regions of the world: Africa, Asia, Europe, Latin America and the United States. We work to advance a range of different reproductive rights: contraception access, abortion access, maternal health care, assisted reproduction. The strategies we use in our work are very broad. We advocate with policymakers, we work in courtrooms through strategic litigation. We provide a lot of support and protection to human rights defenders and national civil society in national contexts who are working on sexual and reproductive rights. And one of the reasons we're here today, we also disseminate information, evidence and data on important reproductive rights issues globally. And we're delighted to be here to launch this new analysis today. As Geraldine said, we are celebrating at the end of this week International Safe Abortion Day, so I think it couldn't be more timely that we talk about the state of abortion law and policy and abortion access in the European region. And this new analysis that we're launching today presents a comprehensive analysis over 49 countries in Europe. And you can access this through a QR code, and I believe for those of you that are joining us online, a link has been shared with you and you can access the report online. The analysis presents, as Geraldine said, a very comprehensive legal overview of abortion access throughout these 49 European countries. It looks at the state of play currently, it highlights the regional trends in terms of legislative reform, and it points to the type of legal and policy change we still need to see in the region. So I'm going to walk us through 3 of the top line data points in the analysis, and then I'm happy in our questions and answer session to go into more detail on all of these and other issues we've covered in the analysis. So I'm going to first take us through the general legal landscape and the grounds on which abortion is legal in our region. Then we'll look at the trends in terms of legislative change. And finally, we'll look at the kinds of harmful barriers that still exist in European laws and policies and that still impede access to care for many women in our region. So what is the legal landscape in Europe currently? When is abortion legal? In what situations? In what countries? So the fact is that most countries in Europe have now broadly legalized abortion, and they are steadily moving towards removing access barriers from their laws. So here you can see a very quick recap of some of the data from the report that shows that essentially in almost all European countries, in 43 of the 49 countries we've covered, abortion on request is legal. And abortion is also legal in all of these 43 countries and in a few other countries on a range of additional grounds. So when a woman's life is at risk, her health is at risk, or in situations of severe or fatal fetal impairment. And in the publication that you should all be able to access, you can look at page 17 and also at page 35 and 36, where you can see a very detailed chart that goes country by country and walks you through every country of these 49, in what cases, in what situations have they legalized abortion, and what is the legal situation in that country. So there's a lot of detail there that I won't go into, but again, happy to answer questions about specific countries or how these numbers break down more. So if we look at these 43 countries that have legalized abortion on request, and abortion on request means that laws allow a time period in which a woman can make her own decisions about accessing abortion care. She doesn't have to obtain a doctor's validation or an attestation from a doctor that a certain medical reason exists for the abortion. So we've covered 49 countries in the report. We see that 43 allow abortion on request. There's a gap. There's 6 countries, right, that don't show up there in that number of 43. So what's the situation in those 6 countries? Well, 5 of them, and they are highlighted here and named here on this map that you should be able to see, they retain what we call highly restrictive abortion laws or near total bans on abortion. And these are Andorra, Liechtenstein, Malta, Monaco, and Poland. And the laws in these countries basically prohibit abortion or allow it only in very narrowly defined circumstances. And essentially in these 5 countries, abortion is almost impossible for women to access at all. Andorra has the region's only remaining total ban on abortion. In Malta, abortion is only legal to save a woman's life. And then in Liechtenstein, Monaco, and Poland, there are some additional grounds, but essentially abortion is almost fully inaccessible. And these laws have a very grave impact on women's health and well-being. They cause very severe and grave human rights violations. And we can talk a little bit more about what that looks like. But essentially in these contexts, most women either have to travel outside of their home country to access care, or they have to use criminal pathways to access care, usually by importing medication through telemedicine services run by NGOs in other parts of the region. So, moving on in terms of what are the legal trends in the region, we've seen that we have, generally speaking, pretty broad legality of abortion in the European region. What's the trend? Well, I think it's safe to say that the trend is squarely a progressive one. The analysis outlines in some detail that we've seen in the past 10 years, 20 European countries undergoing progressive legislative reform to remove existing and prevailing barriers and restrictions on access to care that their laws still include. So we've seen some countries move from what were near total bans to legalizing abortion on request. We've seen other countries extend the time periods for abortion on request. We've seen many of these 20 countries remove other forms of barriers like mandatory waiting periods or mandatory counselling requirements, and we'll talk a little bit more about those types of barriers in a minute. We've also seen 10 countries currently still in conversations about the possibility of additional progressive reforms. So we have many countries in our region where lawmakers, policymakers are actually discussing at the moment the possibility of advancing their laws further, protecting access to abortion further, and removing barriers. At the same time, we have to be vigilant in this region, and we mustn't kind of be overconfident, because we have had a number of countries who have taken a step backward. And you can see here on this slide how it breaks down. 20 have moved forward, but 7 countries in our region have introduced new legal barriers into their laws in the last 10 years. And there have been attempts, they've been unsuccessful, but there have been attempts in some other contexts to introduce these kinds of regressive restrictions, new restrictions. And then to move us on to talk about the kinds of legal barriers that still exist in our region. And I want us to focus on those 43 countries that I named that have abortion on request. So the fact that a country has legalized abortion on request, and Noemi is going to talk a little bit about Switzerland in detail, and Switzerland is one of these countries. Does the fact that abortion on request has been legalized, does it mean that those countries have done all the work that they need to do? Does it mean that their laws and policies are perfect? Not at all. The reality is that in these 43 countries that have legalized abortion, there are still a range of regulatory and procedural requirements in the law that impede access to care for many women. And these barriers contravene human rights standards, they contravene modern clinical practice, and they contravene WHO guidelines. And it's not the case in all of these 43 countries that these laws that legalized abortion are, old laws, but the reality is that many of these countries did legalize abortion 20, 30 years ago. And so their laws are just out of date now with the modern state of international human rights law and the state of clinical practice, and they really need to be updated to remove these barriers. So what kind of barriers, when I talk about regulatory and procedural barriers, do we mean? And again, this is broken down in quite a lot of detail in the publication, but we're talking here, you can see a snapshot about things like mandatory waiting periods, mandatory counselling requirements, criminalisation, and we're going to look at those three in a little more detail with some graphics. Financial barriers. What do I mean when I say financial barriers? Well, of the 43 countries that have legalised abortion on request, it's great. 20 of these have adopted policies that cover access to abortion on request under public health insurance or provide it free of charge. But that means that 23 of these countries do not do so, and women in these 23 countries still have to pay out of pocket for this form of legal, necessary healthcare. Third-party authorizations. The report details that this is a type of barrier that affects particular groups of women specifically, and we look in detail at adolescents and the fact that in most of Europe, adolescents still need parental consent, and laws specify that girls under 16 or 18 need the consent of a guardian or a parent before they can access reproductive health care. We are seeing, though, as we outline, that there are 10 countries in the region who have started to move towards better laws for adolescents. They've removed these very strict types of parental consent requirements, and they've put in place confidential and human rights compliant mechanisms for them to access care. And then finally, distress requirements. This is a very obscure type of requirement that's in place in 4 contexts, including Switzerland, where essentially to access abortion on request, women actually have to sign a piece of paper saying that they are in distress and that it is their distress that is their reason for ending their pregnancy and for seeking abortion care. So again, this is an out-of-date and unnecessary barrier. And then just quickly to look at mandatory waiting periods in the region. 29 countries in Europe have eradicated mandatory waiting periods completely. This is great, and we still are, many countries are in the process of talking about removing mandatory waiting periods, but we still have 14 countries in Europe that retain these barriers. Mandatory counselling requirements, we have 27 countries that have removed mandatory counselling requirements, and that is again a great step forward, but we still have 16 countries in our region that retain mandatory counselling. And just to highlight that 3 of these 16 countries, Germany, Georgia and Hungary, impose biased and directive counselling on women prior to abortion, which means that the counselling must seek to dissuade women from having an abortion. So this is a very egregious barrier that is really harmful to women. And then finally, I wanted to focus on criminalisation and the fact that in Europe, although abortion has been legalised, every country in Europe still retains some form of criminal law that residually criminalises abortion when it is performed or when it takes place outside of legal pathways. And that means that every country in Europe treats abortion differently to all other forms of healthcare, because all of our healthcare that we access on a day-to-day basis there's not criminal laws governing our access to that healthcare. But when it comes to reproductive healthcare and women's access to abortion, these laws do exist. The country that has come closest in our region to removing all criminal laws on abortion is Northern Ireland. It went from a near total ban a few years ago to now one of the region's most progressive laws on abortion, and abortion is almost fully decriminalised there, but not fully. The most concerning group of countries in terms of criminalisation are the 20 countries in Europe that still criminalise women who have abortions outside of legal pathways. So 29 countries in Europe have removed sanctions on women in terms of their own access to abortion care, and they keep some criminalisation for healthcare providers or people who assist women. But we do still have 20 countries in the region, and we can talk more about which countries they are and what that looks like in more detail, who retain criminalisation for women who have so-called illegal abortion. And so I also want to flag that in the report we look in detail at medication abortion and access to abortion medication, and we also look at self-management and when it's legal, and I'm happy to answer questions on that. I want to just close before I hand over to Noemi to just flag that in our report and in the analysis we have a range of different detailed recommendations for decision makers and for European governments, and this slide recaps those. We are looking and calling for European governments who care about reproductive rights, who care about gender equality, to step up, step forward at this important moment of time, to use the fact that International Safe Abortion Day is taking place this week, to look internally in their national context and ask themselves, are we doing everything we can here at home to take care of women's health and well-being and provide access to abortion care? Are there barriers that still exist in our laws? Governments should be removing barriers, should be decriminalising abortion fully, removing countries that retain highly restrictive laws should be repealing those laws, legalising abortion on request, and financial provision for people to access abortion care free of charge or highly subsidised should be put in place. And thank you very much for allowing me to walk you through the publication. I'm looking forward to your questions and happy to give more details later on.
Thank you very much, Leah. Now I give the floor to Noemi for maybe the Swiss context. And yes, you have.
Yes.
You can.
Thank you so much. Also really delighted to be here. Thanks for the invitation to the Geneva Press Club, but also to Center for Reproductive Rights, also for the partnership. And in the name of Amnesty International, we're really very grateful for the work of the Center for Reproductive Rights. For this research, for this data. It equips activists and civil society to really drive reforms forward and to protect the right to abortion. Amnesty International recognizes that significant progress has been made in the fight for sexual and reproductive rights over the past years, especially in strengthening the right to abortion. However, in recent years, there have been setbacks in some countries, including in the European context, such as Poland, but also globally. One of the examples is, of course, the US. Thousands of women can't exercise their human right to choose over their bodies. Moreover, doctors, healthcare professionals, pro-abortion activists, and lawyers who defend the right to abortion and provide related services are being threatened. They are intimidated, exposed to physical and verbal attacks, defamed, stigmatized, and also subjected to unjust prosecutions. These individuals are human rights defenders. They fight for our human rights, including our sexual and reproductive rights. And Amnesty International will remain side by side with these brave people, with our outspoken support, with our legal support, and with international solidarity actions. If we shed light on the situation of abortion in Switzerland, we need to speak about some of the basic facts on abortion first. An abortion is a matter of public health, and access to it is a human right. Every person who can become pregnant has the right to decide for themselves whether or not to terminate a pregnancy. An abortion should be treated like any other healthcare service or essential healthcare. Abortions and the related aftercare must be accessible, affordable, of good quality, and provided without any forms of discrimination. Amnesty International supports the full decriminalization of abortion and follows the recommendations of numerous UN human rights bodies in this regard, including the Human Rights Committee, the Committee on Economic, Social and Cultural Rights, the Committee on the Elimination of Discrimination Against Women, and also the guidelines of the World Health Organization. Criminalizing abortion doesn't stop abortions. It only makes them less safe. And full decriminalization includes ensuring there are no criminal penalties for having, assisting with, providing information about, and providing abortion for all relevant actors. Abortion in Switzerland is still regulated under the criminal code. It is only permitted under specific conditions and remains criminalized in principle. It is legal up to the 12th week, and as Leah rightly mentions, it needs to be declared as a pregnant woman or pregnant person in written that there is a situation of distress, an emergency situation. This is very problematic because it reinforces the idea that abortion is not a normal part of healthcare, that it needs to be an exception, exceptional hardship, and it's not about the autonomous decision over one's body. In 2022, a petition of Swiss civil society led by Sexual Health Switzerland called for the removal of abortion from the criminal law. A parliamentary initiative with the same goal was narrowly rejected by the National Council. However, the Parliament subsequently decided to task the Federal Council with producing a report on the implementation of abortion law in Switzerland and whether the legal situation is actually aligning with the World Health Organization guidelines for safe abortion. Amnesty International supports such a report and review in order to identify the gaps and plan for measures so that everyone can exercise their right to abortion. For that, we call on the drafters of this report to seek views of different groups, including those most vulnerable and marginalized, such as migrant women groups, the LGBTIQ community, and sex workers, those with exceptional barriers in accessing legal abortions in Switzerland. There are also good news in Switzerland and steps in the right direction. As of 2027, and this year is still to be confirmed, abortion services in Switzerland will be fully covered by the mandatory health insurance, without any out-of-pocket payments for the pregnant person. This is a major step forward, achieved through years of advocacy by sexual health centers, feminist activists, and the civil society. It reflects the position of UN human rights bodies and the World Health Organization, which emphasizes that abortion care should be publicly funded through public health insurance schemes or provided free of charge to those who otherwise cannot afford it. However, people without health insurance, and that's often the most vulnerable in our Swiss society, such as undocumented migrants, are still excluded. Solutions must be found to ensure truly universal access to abortion. There are other barriers persisting and important to mention in Switzerland. The access to abortion varies widely in between cantons. So it depends where you're living and how your access to abortion looks like. Not all hospitals provide medical abortions, despite it being a safe and effective method and being part of the guidelines of the World Health Organization. There are also significant differences in protocols, especially regarding time limits for medical versus surgical abortions across cantons and even across hospitals within a canton. There is also the access to telemedicine, a form of self-managed abortion, which is a model used in the canton of Geneva, but it's not accessible in every canton in Switzerland and also not in all the hospitals. So these are barriers which are persisting in Switzerland. There is one other barrier, and that's the well-resourced and transnational anti-gender movement who is spreading fear, division, and also misinformation to maintain restrictions and roll back access to abortion and gender equality at large. This is happening across Europe, but also in Switzerland. We were observing a large campaign last spring, more in the Swiss German cantons in Switzerland, in public spaces, in train stations, where the anti-choice movements tried to create false fears and prevent timely access to essential health care and prevent access to abortion. In a world where sexual and reproductive rights and gender equality are under attack, we must resist and organize to defend our rights and ensure that all people can exercise their right to bodily autonomy. Amnesty International calls on all states, including Switzerland, to fully decriminalize abortion and ensure universal access to safe abortions for all who need them. The decision to terminate a pregnancy should be left to the individual and not regulated by criminal law. We call on all states, including the Swiss government, to also ensure access to accurate, non-biased sexual and reproductive health information, including comprehensive sexuality education, as a fundamental to inform young people about their rights. And Amnesty International stands for Switzerland and a world where everyone can exercise their right to bodily autonomy without fear, shame, or legal barriers. And we're really happy to answer any questions on the situation of Switzerland and the demands of Amnesty International.
Thank you. Thank you, Noemi, for these words about the Swiss context. And thank you, Leah, for this very interesting report. It's very, very important to have facts about this subject, to have studies, serious studies about this subject. It's very important for the woman, it's very important for the society, and it's very important to against the polarization in the society now. Yet, now it's time for questions. I have one question from Emma Pirner from Euractiv. I can read the question. Does the report consider the thousands in the Europe who are required to travel across the bloc to get an abortion? It's the first question. Leah.
Yeah, just to confirm, I understand the question. So does the analysis look at the women who have to travel to other countries to access abortion care outside of their home countries? Yes, the report does. So we're not documenting the analysis of numbers of women who have to travel. There's other really comprehensive research available that we can share in follow-up that provides this information and really breaks down who is traveling in Europe for abortion care, from what countries, and the reasons they are doing so. The countries in Europe that women travel to are well known. So women often travel to the Netherlands for care, to the UK for care, and also women like within Eastern Europe, particularly Poland, who face access and have to travel. They may travel to Germany for care. or to Austria for care. So there are locations in Europe where women travel to, and data is available from these countries, often showing who is traveling and why. Our report doesn't cover that. What we do cover is kind of looking at the legal and policy reasons why women may travel and why we still see the reality of travel within Europe. The first places that we see travel from are those 5 countries that I highlighted that have highly restrictive abortion laws. And the biggest of these is Poland. The most well-known is Poland, and it is a significant population of women who still cannot access legal abortion within their home context. Many women in Poland are now importing, through telemedicine services, medication abortion, and they are managing their own abortions. And they are doing this outside of legal pathways, so it has a range of different consequences for their health and well-being, and is highly problematic in human rights terms. And last year, the UN Committee on the Elimination of Discrimination Against Women issued a groundbreaking findings and analysis of the grave and systematic human rights violations that are being caused by the Polish abortion law. And the committee looked in detail at the reality of travel for women in Poland and what it means in practice when a woman has to leave a healthcare system that she knows, and leave doctors and carers that she knows, and leave her family behind, and make an extremely lonely journey, often in fear and in secrecy, to a foreign country and a foreign healthcare system to access healthcare. The report also touches on the other countries that retain highly restrictive abortion laws. They're Andorra, Monaco, Malta and Liechtenstein, and women from those countries also have to travel. But the reality is, and this is what I think is really important for policymakers in Europe to take note of, we have 43 countries in the region that have legalized abortion and have carved out a space in their law in one way or the other, imperfect as it may be, saying that abortion should be legal and accessible. But the reality and the data that on women who are traveling in the region shows that women are traveling from those 43 countries. So something is wrong, right? If you've carved out in your law and you've said abortion should be accessible here at home, why are women still traveling? And what our report is showing is the reasons why in terms of legal and policy reasons. And those reasons are often the fact time periods, and this is one of the things we look at in detail, time periods for abortion on request in the European region are quite limited. And we are seeing a really welcome development in a number of countries. Even just this year, Denmark and Norway have expanded significantly the time periods for abortion on request. Iceland has done that also in the last few years. But the reality is that in most of the 43 countries that allow abortion on request, the time period is very short. It's usually around 12 or 14 weeks of pregnancy. And there are different reasons why a woman may miss that time period. People have irregular periods. People don't know that they're pregnant. Women can be up against that deadline if there's a mandatory waiting period, if there's mandatory counselling they have to go through. The reality is that a woman can miss that 12 or 14 week deadline just as a matter of days. And she is then excluded from access to legal care in her home country. And these women are travelling. We have seen some countries in the region, like France, take measures in recent years because of this data that is showing a significant number of women travelling from their context, and they have lengthened their time periods, and this is really welcome. But we need other countries in the region to look at this as a problem. The other thing that is causing women to travel and that is excluding them or debilitating their access to care in their home country is, as Noemi was talking about in the Swiss context, criminalisation. And the fact that what criminalisation does is, although the law says that abortion is legal, the fact that there is all of this criminal law that still persists, it deeply stigmatizes abortion. And it can mean, in some contexts where abortion stigma is high, a context like Germany is a notorious one in our region, it means that medical professionals and young people training to become doctors often aren't trained properly on abortion. Abortion is not readily provided throughout the country. If you're in a very big country like Germany or like Italy, where stigma is high, where you don't have a lot of doctors who are providing care, the distances of travel are extreme. And so sometimes women will not just have to travel long distances within their own contexts, but also to foreign countries.
Thank you for the answer, Leah. There's no other question. Just one. Wait. Yes. Okay. Just I read the question. Huh? How do you move from making recommendations to making sure political representatives or decision makers actually consider them? We've seen recent changes in the US regarding abortion. Do you think they influenced European countries that decided to restrict abortion? Has this also influenced your own research or work? Who wants?
Maybe, yeah, I can answer first.
Yes,
and then Noemi.
After Noemi.
So the reality is that the way in which you transcend from making recommendations to actually influencing policymakers is there are many different ways in which action is needed. So you need to bring evidence and data to policymakers. I think we have seen in the European context in these 20 countries that I talked about who have made progress in the last few years, data and evidence has been critically influential on decision makers in those 20 countries. And we've seen decision makers in many of those countries who didn't believe change was necessary, who thought everything is fine in our context, or who were actually anti-reform and anti-abortion care. We've actually seen decision makers change their minds and open their eyes when they receive data and evidence. That's why it's so important, for example, in Switzerland, that this review is taking place around looking at the gaps in practice and how the law is really working or not working for women. So we have seen in these 20 countries that have undergone very progressive reforms recently, the fact that evidence and data has been really transformative for decision makers. The other ways in which decision makers, I think, are really influenced, and this is often something that's, I think, a sad fact, but sometimes individual women have had to stand up and publicly tell their stories. And they've had to talk in public about how they have suffered because they have been denied access to abortion care. We see, for example, this is in Ireland, a country where the Centre for Reproductive Rights worked really closely with Amnesty, with Irish civil society to bring about change there. We saw how crucial it was that women started to talk publicly, but also to their friends and their family members, their co-workers, about the fact that they had to travel for abortion care and about the ways in which the abortion ban in that context was harmful to them. So this is something that's also very influential, not just with policymakers, but also with the media and with influencing public thinking and helping people understand that it's always about a woman you love is the person who's going to need the care, and so action needs to be taken for her. And I think the other thing that is influential with policymakers and that can galvanize political will is grassroots mobilization. And we're seeing this across Europe and globally, that the power of people when they stand up, when they get together, when they go out into the streets and when they take different campaigning actions and really push and call for their rights to be respected, that is a really powerful impact on politicians and on policymakers, and sometimes can be the most influential thing in getting politicians to take note. In the United States, the situation is extremely grave. The Centre for Reproductive Rights is deeply embedded in the US context and working on an hourly, daily basis to defend the rights of people in the US who need abortion care. 77 million Americans now live in states that do not have abortion, that have banned abortion following the 2022 Supreme Court decision. Nearly 1 in 5 people in the US who needs an abortion has to travel for it. Maternal death rates in the states in America that have banned abortion are 62% higher than in the states where abortion is still legal in the US. The US is one of only 4 countries globally. It's joined by Poland in the European region that has actually gone backwards and removed a ground for legal access from its law. So it's a really grave situation. Is this situation impacting in Europe? Yes. And the first thing I want to point out is that it's actually positively impacted here. So when the Supreme Court decision in the Dobbs case was handed down by the US court, we saw a wave of European decision makers and governments saying, oh my goodness, this is horrifying. We must take action here to try to prevent something like this happening in the future in our national context. And we saw France is perhaps the most famous of these examples, where the French decision makers brought into being a constitutional provision protecting entitlements to abortion. But we've also are seeing decision makers in Luxembourg, in Denmark, in Sweden, in Belgium, name just a few, also seriously considering constitutional protections for abortion access in direct response to what happened in the US. And following that 2022 decision, we saw a range of other countries in Europe not talking about constitutional protection, but really moving fast to remove barriers from their laws. So we saw Finland doing this, Denmark, Norway, just to name a few, and there are many more, actually taking law reform, undergoing it, and improving their laws. So that's been a really positive impact, if you like. But as Noemi said, the situation is not without threat, and we are very concerned about the efforts that are being made to kind of polarize the European context on abortion and kind of use tactics that are being used in the United States and bring them to European contexts. And we do believe that we are at a moment in time where European decision makers really do need to be vigilant, and we really need to ensure that we prevent regression and that we continue with this progressive trend to stem any forms or attempts at backlash. And we are seeing, particularly in Eastern European countries, attempts ongoing kind of every quarter in the political cycle in some contexts, like in Slovakia, for example, where there are real attempts to roll back abortion rights. And we know that that some of these are informed by and fueled by events in the United States.
Maybe
Thank you.
Noemi, from an Amnesty International perspective, we are working with people power to change laws and situations of human rights violations, and that's the most powerful way to do it. We've seen and observed the Ola Verde in Latin America, who really pushed forward legislation and legal abortion laws in Latin America, and that was due to human rights activists and feminist activists. It's really important to bring concerned people, or the people really having or wanting to have abortions, to the policymakers, because often it's still majority men being as political decision makers. They do not know what it means to wanting to have an abortion, or what kind of barriers we're facing as people who can become pregnant. So therefore, we need to raise the voices of the people who really know what it means in reality, and enabling conversations with policymakers so they understand what the real barriers are, also still in Switzerland. Concerning the US influence, as Leah said, if there is an influence, let's say in Switzerland, there is one in the money flowing in the anti-choice movement. Also in Switzerland, there is a very interesting research by the European Parliamentary Forum on Sexual and Reproductive Health and Rights, who track where the money is coming from to anti-choice movement, and it's largely coming from the US. However, on legal influence in Switzerland, what is really interesting to observe is that the majority of the population in Switzerland is really defending the right to abortion again and again in popular votes, but also there were attempts by the right-wing movements in Switzerland to restrict the access to abortion with mandatory thinking periods and things like that. And they didn't even they weren't even able to have enough signatures to even have a popular initiative. It shows it's not possible in Switzerland to really do legal steps backwards. We have to do steps forward. Our law is 22 years old, it's outdated, as Leah also said. We can make a step forward, and we've seen that with this good news about the mandatory health insurance. It's a best practice that we can also share with contexts such as Germany or Austria to show them it's actually possible, even in this climate, to make step forwards, and we don't need to let ourselves impress too much to what's happening in the US. We need to make steps forward.
Okay, thank you for these answers, and I have another question. But first, I would like to ask a question concerning this atmosphere against or about abortion. There's political makers and there's social media. For example, traditional positions like your body, my choice. You know this kind of positions in social media. Is there influence about with a young woman who could consider that abortion is really not good, and so what? What do you think about the influence of social media about the young woman, young people?
Yeah, social media is definitely an impact on young people. It's a source of information that's very known. That's why it's so detrimental to have comprehensive sexuality education in school. In Switzerland, every child goes to school, and therefore everyone has or would have this access to information. They need to be accompanied in understanding what are real facts and scientifically based information and what are misinformation, because there is more and more misinformation spreading in social media. So this is a really important thing to consider also in the context of Switzerland. We don't have yet a full comprehensive sexuality education. It's again very varied in which canton we are. This is not possible. Every child needs to have the same information available. So I would say that's really coming from that, the demands to political decision makers to really push comprehensive sexuality education.
And also just to add that while I think it's very important to talk about young people and social media and understand how it's impacting and whether it's having an impact in terms of shaping their thinking on reproductive health, we also see certain contexts where social media has been very much a positive part of the movement for change. And in the analysis that we've launched today, we highlight how change was made in Ireland as a particular example, and we also point to a publication there that we've published with a number of other organisations across the world, looking at how legal and policy change was made on different reproductive rights issues in these different, I think it's 11 or 12 country contexts. And again, looking at the Irish example, we've seen how powerful social media was in that context in enabling people to mobilise and enabling young women to mobilise, both those who were living in Ireland, but also Ireland has a very huge expatriate community across the world. And we saw this wonderful social media work around women coming home to vote, and how uplifting that was, not just for people in Ireland, but for people all over the world. So I think we can also see examples of how social media has been something that's been really transformative. Sometimes when it comes to issues like abortion and reproductive health more generally, there's a sense that they're private, or there can also be a level of shame and stigma around them. And one of the things that these kind of movements, and as Noemi said, the power of people coming together, sometimes on social media, is that you realize you're not alone, and people get together in different ways across borders, across country lines, to really work together to bring about change. So think there are also some very positive examples.
Thank you, Leah. And I take another question from Emma Pianet again. Could you expand on the ways in which legal and policy barriers to abortion access are harmful for health?
Yes, so the reality is that, and this is made very clear by the World Health Organization, who last year published new guidelines for WHO member states on abortion care. And essentially what the WHO sets out there is that abortion is essential health care, that it will be needed by many women in their lifetime, and that it must be regulated and made available in a way as all other forms of health care, and regulatory barriers and procedural things that are put in place to limit access or control access are really harmful in terms of public health and individual health. So if we look, for example, at a mandatory waiting period as a particular example and unpack how is that harmful in practice to women's health and well-being. You know, sometimes people think, well, it's only 2 days or it's only 24 hours. Why does waiting matter? So what a mandatory waiting period means is that you have to go to a medical facility and request an abortion, and then you have to wait this certain kind of thinking period or reflection period, and it can range in Europe between 24 hours and 7 days, and you have to wait for that time period until you can actually then access the abortion care. So what it involves is it involves at least 2 contacts in many countries where telemedicine is not legal, and most countries in Europe still require women to go to a healthcare facility at least once and take one of the abortion pills, medications in that healthcare facility. So in all of those contexts, women will have to make at least 2 visits to the healthcare provider before they can access abortion. And as I talked about earlier, many European countries put quite strict time limits on access to abortion on request. So let's say you have a 12-week limit. So that's essentially you may have missed 1 period, 2 periods, in terms of you realize you're pregnant. Maybe you're on contraception. Most women who access abortion care in Europe are already on contraception. Most women already have children. Most women are in a committed relationship. So women may not realize they're pregnant. Mm-hmm. They miss a period, they miss a second period, they realize. They're coming very close to that 12-week deadline. And then they have a mandatory waiting period that they have to observe. So if it's a 2-day period or a 7-day period, it can actually be the very thing that means you can't get access to abortion care, that pushes you from that 12-week to that 12-week 0.2 days time frame. So it delays your access to care. The WHO says abortion care should be provided as early as possible. Women should have access immediately if they want to. And it demeans women as decision makers. There's no other form of healthcare where people are obliged legally to go away and think about it. So that's what these laws say to women in terms of mandatory waiting periods. They say, we don't really trust your decision on this. We want you to think about it more. So it's very demeaning to a person as a decision maker in terms of their own access to healthcare. So that's just one example. But essentially, all of what these barriers do is delay access to care, undermine the quality of the care, and essentially often prevent people from accessing legal care. That is really problematic in terms of health and well-being.
Maybe just to add to that, to not see abortion as healthcare is actually acting like contraception is 100% safe, which is not the case. There is no contraception which is fully reliable to 100%. That's why abortion care needs to be considered also legally as healthcare, because there are many cases where contraception is used, there is still a pregnancy happening, and we need to have the access to then terminate this pregnancy to also exercise the right to bodily autonomy and actually the right to health.
Thank you, Noemi. Is there question? No more. Okay. Thank you, Leah Hoctor, Vice President for Europe at the Center for Reproductive Rights, and Noemi Grütter, Campaign Coordinator for Gender Justice and Individuals at Risk at Amnesty International, Switzerland. Thank you too for this presentation of the report. Very important studies. And I can understand now that there's positive ways, positive news for the right women's rights. It's a good conclusion for me. And yes, job to do, but good news and good ways too. Thank you very much, and yes, have a good day. Thank you.